Mental health is a global issue. Mental health disorders constitute a major portion of the total burden of diseases globally and are considered an even more serious problem in conflict and post-conflict settings. 1 out of 10 people are suffering from mental health disorders, neurological problems, and substance abuse. It is indicated that 1 out of 4 families has mental, neurological, and substance abuse problems. Due to decades of war, political unrest, instability, poverty, natural disasters, unemployment, inadequate access or lack of access to mental health services, many Afghans have been suffering from mental health and psychosocial problems. According to HMIS reported data in 2016, 3.9%, in 2017, 4.3%, and in 2018, 5%, of the total outpatient cases could access mental health services, which is very low compared to the Ministry of Public Health's recommended target of 10%.
Since the women, girls, and children need female psychosocial counselors in order to consider gender issues, want to train many females as psychosocial counselors and deploy them in health facilities. Another plan is to support and enhance the mental health units, which has already been established in each hospital to help people. These units are currently operational at provincial levels and should also be expanded to district levels because the district hospitals also need for establishing such units that can work for mental health services. Our next plan is to implement suicide prevention strategy to prevent suicide. In addition, further efforts were needed to increase number of specialists so that they can be employed in district level.
سروی سال 2018 وزارت صحت عامه نشان داد که فیصدی شیوع امراض روانی
National Mental Health Survey in 2018 showed prevalence of mental disorders. Depression 4.8%, anxiety 3.7%, psychological distress 46%, and impairment role due to psychological distress is 23%, substance abuse disorder 8%, and experience post-traumatic stress disorder 5.8%. There are many challenges with mental health, such as lack of enough budget, and due to stigma or shame and lack of awareness and security problems, people do not access to available mental health services. There is needed for more efforts to solve these problems.
There is limited access to mental health services for the high number of people suffering from mental health problems. Inadequate financing of mental health and psychosocial interventions, increasing behavioral and substance abuse among youths.
I would like to first express my gratitude for this opportunity to reflect about the efforts committed by European Union towards the health sector in Afghanistan. This is nothing new. It has started actually from 2001, and since that time we have steadily been one of the major partners of Afghanistan towards strengthening the health sector in this country. We do it through different channels, either on budget or off budget. We also address several facets of the health challenges in Afghanistan.
I'm currently in Kabul, Afghanistan, with our local organization HealthNet TPO. HealthNet TPO has been in Afghanistan for 25 years. We have worked at offering integrated health services on various levels. We work with the Ministry of Public Health in strategy development, in policy development, and we implement basic level and basic health services, but on an integrated level. That includes hospital, clinics. Yesterday I visited a clinic where families could go to for vaccinations, for family planning. I visited a training center for counselors that counsel the general population, people in need, on and provide psychosocial support and mental health services.
HealthNet TPO offers evidence-based and culturally appropriate mental health services to communities that foster self-reliance and promote sustainable healthcare that is accessible to all. HealthNet TPO's mission is to enhance the ability of communities in fragile countries to better manage and maintain their own health and well-being by using health as both the goal and the means for addressing the community's problems.
Fortunately, we were able to train 326 psychosocial counselors during 3 years project, of which 207 were female and 109 were male, who completed 1-year psychosocial training program and certified by Ministry of Public Health. Currently, they are actively providing psychosocial services in their health facilities. 260 medical doctors have been provided 2-week mental health training course, and 256 midwives, nurses have been provided 1-week mental health training to provide mental health services in comprehensive health centers.
A committee is organized comprised of the Provincial Health Directorate, HealthNet TPO, and the BPHS implementer, in collaboration with the Mental Health Department of MOPH for the selection of psychosocial counselors. Their training duration is 1 year, with 3 months of intensive training consisting of classroom training with working hours of 8:30 a.m. to 4 p.m.
We have 3 types of supervision. Telephonic supervision is the one carried out by trainers. They are contacting psychosocial counselors 2 times a week. Second, group supervision. It is for insecure areas which we cannot visit. Third, field supervision, where we supervise psychosocial counselors' performance on the spot.
HealthNet TPO Afghanistan is managed by a team of qualified and committed Afghans and supported by a team of experts at the head office in the Netherlands. HealthNet TPO is working in close coordination with provincial public health directors.
We conduct mental health meetings once a quarter where we invite BPHS, EPHS and other vertical programs staff. And we discuss issues relevant to mental health that can be patients, cure, preventions, treatment, pharmaceutical and referrals.
واقعیتش ما این خدمات سرش کار میکردیم ولی زیاد فوکس ما سر از این خدمات قبل از اخذ ترینینگ.
In the past, we were providing mental health services and counseling was not our focus. We were mainly providing medication, but not counseling were provided. After mental health training and deployment of psychosocial counselors, we provide counseling to the clients. Now we know that all mental health cases do not need medication and can be treated with counseling.
We first provide health education when a patient comes to us. Then patients who have issues such as stress, anxiety, and depression, we diagnose them and afterwards refer them to a psychosocial counselor. The psychosocial counselor provides counseling and then refers them back to us for diagnosis and medication if needed. After we received mental health training, we now know that when a mother comes to us in the postnatal care period, we know this period is a sensitive time for mothers. If the mother does not cope with it well, it may lead to depression, and now we can recognize the signs and symptoms of mental health disorders if she has them. We bring our monthly report to the health facility. We discuss it with the psychosocial counselor and the doctor. Then they tell us that if we face anyone with mental health or psychosocial problems, we refer him or her to the health facility. When I joined the health facility, not only the clients, but also the health facility staff thought that psychosocial counseling was worthless. But when we provided counseling to them, they found out that their problems reduced and improved. And now they have realized that counseling is a good option in addition to medication. If a person is feeling isolated, depressed, pulling her hair, does not eat, and sad, and telling us that she thinks she is alive today but not tomorrow, we have a psychosocial counselor in our health facility to help. I personally referred 4 patients, of which 2 have been completely recovered. My husband was jobless and did not do anything for a living. He could not afford the expenses. Whenever I asked him for money, he fought and broke glasses and doors. Finally, I came here. I told to the sister that my body is burning and pricking. What should I do? During the assessment of the mental health condition of the patient, we assess whether there are any changes in the condition of the client and if his or her condition is improved. This section provides services every day. We will talk with you about your illness. If you need, you will be given medication. If not, counseling will be enough. After completion of a 3-month intensive training, the psychosocial counselors are deployed in relevant comprehensive health centers, CHCs, where they are practicing what they learned during the training. In addition to the 3-month intensive training, 2-week refresher courses are also conducted for psychosocial counselors in selected health facilities. The refresher training mainly focuses on the challenges and problems they face during practical work. At the beginning, not only clients, but even our health personnel did not believe in psychosocial counseling. But when they participated in the counseling sessions, their problems were solved to some extent. Now all of the health staff and clients trust psychosocial counseling. Fortunately, it has had lots of effects on my personal life. Previously, there were small problems I could not find solutions for and thought that it was the end of everything. Now, fortunately, I know how to handle these conditions and how to use my coping mechanisms and how to find solutions. Now it will not be like the past to cry all the time. Now I will stand against my problems like a wall.
There is a counselor and providing us counseling sessions. Since she deployed, she called clients and providing counseling sessions and talk with them. People are very happy.
The training we received, we have been using this for helping clients. But still there are some problems that unfortunately we cannot work on. And we need more training and skills in this field to solve them. HealthNet TPO has been working in Afghanistan since 1994 and has successfully implemented numerous initiatives and projects in health and capacity building in the country, with a focus on building sustainable, equitable, and accessible healthcare systems in unstable and fragile states.